Hello and welcome to Public Conscience on Radio, the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with the mandate to work for good governance, participation and accountability in Nigeria. I'm Okiri Agbonsuremi. Adaobi Obiabumo, my co-anchor, is right in here.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention for democratic actions against it. We are supported by the MacArthur Foundation.
The fight against corruption in Nigeria involves a whole lot of efforts. These efforts include investigative journalism, trainings, and the mobilization of media houses to give space, time, and resources to expose corruption. It also includes the mobilization of the citizenry from across this divide, whether at the community level or at the state and national level.
The emergence of COVID-19 has, however, altered or affected some of the different approaches by the CSOs to mobilize the populace in the building of a strong citizens' army against corruption.
One organization in the forefront of supporting the fight against corruption in Nigeria is the MacArthur Foundation.
Yes, the MacArthur Foundation's support for anti-corruption efforts in Nigeria gets to government agencies, and CSOs.
The COVID-19 challenge has taken the center stage, and all hands are on the deck to stem the spread of the virus and discourage the inherent corruption in the entire process.
The civil society organizations involved in the mobilization of Nigerians against corruption have been striving to beat the COVID-19 challenges to do their jobs.
And the African director for the MacArthur Foundation, Dr. Kole Shettima, is joining us on the program today. He will be talking to us via the phone. And in the studio with us is Ezewa Wangu, co-convener of the Say No campaign and executive director, Peer Advocacy and Advancement in Africa.
Remember that you can follow us on our social media platforms at official PRIMOG. PRIMOG is spelled PRIMORG. And we are streaming live on Facebook at official PRIMOG. You can watch our videos on PRIMOG TV, our YouTube channel. Please subscribe to get reminders when we have a new post. And the WhatsApp phone line to send your message is 0902-265-6167. This number is for messages only.
We have Dr. Kole Shettima on the line with us. He will be doing a deal of the talking and they will be asking the question. Thank you so much, sir, for joining us on the program.
Thank you.
Let's talk about the issues on ground, and thanks again for the huge support the organization, the MacArthur Foundation, is offering Nigeria, the Nigerian citizens, the population, and the CSOs in the fight, particularly in the fight against corruption. But let me just quickly ask you, how do you assess the level of corruption in Nigeria? Let's begin from there.
Well, I think I have seen a number of public opinion polls which were published on the eve of the first year anniversary of the second term of the president. And then there was a report that UNODC also published as well. I think that the UNODC report, suggests that increasingly many Nigerians oppose corruption. They feel that corruption is bad for the country. They think that corruption has eroded the values and the development of the country. And they feel that corruption has actually undermined Nigeria's ability to provide services to its own citizens, which I think is a good news because it ensures that the level of tolerance for corruption is reducing in the country, and I think that is the good news. The public opinion polls and both I think the Daily Trust and that produced by the Center for Democracy and Development suggests that about they give a 66% pass mark to the current administration in terms of this fight against corruption. But of course, all of them raise a number of concerns in terms of what is happening. And I think one of the major issues that they raised was that whereas there is a commitment to fight corruption, but at the same time, looks like there are many people who are in the ruling party who have been shielded and not prosecuted, and they should have been prosecuted by the administration as well. So I would say that I think based on those three analyses that we have seen, I think we can say that the cup is half full and not half empty. There are serious problems and challenges that I think that we as citizens we have to face and continue to face and fight back as well, and that we should never allow the issue of corruption to be about an individual or about an administration, but it has to be about the Nigerian people and what Nigerians, as ordinary citizens, consider as the most important thing that we need to do for ourselves, for our children, for the development of our country. We have to do it because this is a commonwealth that belongs to all of us. It's not a commonwealth that belongs to a tiny minority of citizens or people in this country. And we should all worry about what are the implications of corruption for our people, for our country, especially for the younger generation who are coming. I think we are stealing their future. We are depriving them their future. We are depriving them of their livelihood, and that there's no parent, or there's no appropriate parent, or there's no good parent who wants to steal the future of their children and their grandchildren, unless that parent is not. I don't want to use the word, some other words, but that parent is not a correct parent.
No doubt there have been challenges with the emergence of COVID-19. How has the MacArthur Foundation been dealing with some of these challenges?
Well, as we all know, COVID-19 is a major challenge. First of all, I think I want to talk about what we did for our staff, and I think that we have tried as much as possible to ensure that our staff are well protected. We closed our office, I think, much earlier than when the government announced the closure of offices. And up to now, I think that we are still working from home to ensure that, our staff are not exposed to any challenges and other problems. And then secondly, with our grantees, I think that we have communicated with our grantees probably more than 4 or 5 times during this period. First of all, to alert them, to assure them that we are here with them, we will always be with them, to give them the flexibility of doing their work as they can, and they should never think about whether their deadline is now or tomorrow, and therefore how the foundation is going to treat them. The foundation wants to assure, and I think continues to assure its own grantees that their health and their safety come first. They should never worry about whether the foundation is going to be upset or angry that they have not done their work and other things. That is not important to us. What's most important to us is that their own health and the safety and that of their staff and their colleagues, that's most important. So we have assured them several times. And when, for example, they have problems with their reporting or anything, in fact, the foundation have even now agreed to accept verbal reports if people have challenges of either going to the office to send an email, or they are located in a place that they are not able to email, and if they are able to make a phone call, I think the foundation is willing to accept verbal reports of their work and other things. That's in terms of their annual reports. The foundation have also given them that, if they cannot meet their deadlines, they should never worry about a deadline. They can report to the foundation at any time they want. We have also shared with them a number of information around mental health and their physical health during this period, what they should be thinking about, what they should be doing, why they should be taking all kinds of steps. So we have shared with them a number of resources to ensure that they don't run into other problems in doing their work as well. But I think that we have also challenged the grantees, and I'm very happy that they have actually lived up to that. Trying to tell them that in this moment, what is more important and very critical is about civic leadership. It's about how we as citizens take charge of the situation and do what we can in order to respond to the pandemic. So we should not just think about what the government can do, but actually what we should do in spite of or in complementing of what the government is trying to do. And I'm very happy that many of them have come to us and have said that, look, during this COVID, probably we want to do this program or the other program. We want to do some new things because of the COVID that is happening and because of our sense of responsibility to the community that we want to do these things. And I'm very happy that, almost all the grantees and, all of them have come in one way or the other, said that, look, we want to exercise our civic leadership. Civil society organizations have a responsibility to do whatever they can in order to ensure that they also do that. And they do that in different ways. Some of them in terms of public education. So there are a number of people in radio stations, some of them in Nigerian languages, some of them in English language, some of them on television, some are using their newspapers and other programs they are doing in order to educate the public about this pandemic. Others are tracking the resources that are being spent on COVID. So a number of them have organized webinar and training and others. I remember that your program has also organized a webinar on how do you do tracking of resources during this period, because we know that funds are coming in locally and internationally for this COVID response, and we don't want the COVID situation to be an opportunity for some people to enrich themselves, but to provide services to ordinary citizens that actually would deserve the resources at this time. So a number of them have been involved in trying to track the resources that are spent, including some of the palliatives that are being distributed. I think there are a number of grantees who are in the field trying to do that. Others are looking at the modified feeding program, how is it actually being done? Is that the right way to do it? Are there different ways to do those ones? People have gone, some have gone, have made a FOI request, trying to find out from government, how much really money are we talking about, how much has been spent. Some grantees have also been doing work around disinformation and countering disinformation and also doing fact-checking. As we know, there are a number of rumors, there are a number of gossips, there are so many things that are going on in social media about this. So many grantees are trying to intervene and try to find out, trying to counter some of those statements. So I'm very happy, very glad, and very proud of the work that the grantees are also doing, trying to exercise their civic leadership, either to complement where government is, whatever it's doing, also try to cross-check and government. But also, there are situations where governments have failed and they have actually taken leadership and providing services to our citizens.
Thank you so much. We want to also appreciate you, appreciate your team here and the team in Chicago, MacArthur Foundation, for the advisory that was actually provided for us at Primark. I want to tell you that those advisories were very useful to us on how we are keeping safe in continuing to execute our projects that is gradually supported by the MacArthur Foundation. Now, on Tuesday, the health minister reaffirmed that many deaths in Kano recently were related to COVID-19. Are there things we should be doing differently? What are your perspectives in the way government is dealing, particularly in northern Nigeria and in Kano?
So I think that Kano is a very pathetic situation and a very dangerous situation. And unfortunately, because of the nature of the environment, and I think that government initially really understood which were the most vulnerable places in the country. They look at the most urbanized places like Kano, Lagos, Ibadan, Port Harcourt, and of course Abuja as the most vulnerable. And I think they also look at the challenge of these are also our major airport centers. think they also understood those ones. But I think that we made a number of mistakes, I think, in the response. I don't think those were deliberate mistakes. I think they were, in some ways, rational mistakes, in the sense that I think we tried to follow the infection, I think, from the first index case. So because the first index case was in Lagos, so we tried to concentrate in Lagos and try to put the infrastructure and put the resources there to ensure that we contain the situation, which I think is a rational thing to do. But by the way, I always say that I think in some ways we are lucky that this problem started in Lagos. I can imagine that if it had started in another place, another part of the country, I think that the disaster would have been even worse. Because despite all our problems and despite all the problems of Lagos, I think still Lagos has a better infrastructure and better governance structure to deal with these problems than if it had happened in another part of the country. So government, and partly because of the Ebola experience that they had, so they had something on the ground that helped them and guided them. So I think that so I think government put a lot of infrastructure there, and then as the virus tried to move off into the hinterland, and then we tried to also build the infrastructure gradually. So it was next was Ogun, eventually it was Oyo, and then eventually. So you can see, and then of course Abuja. So you can see that the infrastructure and to deal with this problem also gradually moved with the infection. But unfortunately, we never realized that actually by the time that we identified the first index in Kano, there was already a problem in Kano. But we always look at the first index case. But unfortunately, there were so many people who were dying at that time that, we never knew that it was because of COVID. So all of our references were always in the first index case. And I think as now it's been discovered in many parts of the world, the first index case that we report is just the report that actually has been officially reported, but that in many, many places, actually people have died much earlier. It was only later on that people went back to see the record, and in some places they were able to do autopsy to find out that actually those people who died earlier were also as a result of COVID. Although the first index case might have been discovered a month or two, even in some cases after the situation. Even now, I think that as you have followed in the situation of China, there is a claim that probably the problem started as early as August, based on imagery of hospital attendants and the record of searches of computers and other things. There is some suggestion that probably this problem started as early as August, whereas, as we all know, the first case that was reported was in January. So there was like a 5-month gap in that one. So in Kano, I think that was the same situation that we have found ourselves, whereby, people died, and unfortunately, the first set of people who died are supposed to be prominent people. And so the first set of people who died are supposed to be prominent people. So prominent people are the people there where also people attend their funerals. And now I think we know that probably a lot of the people who attended those deaths of prominent people also got infected in those places. I think there's what is called super spreader events. So I think there is some analysis now which suggests that most of the infections happen as a result of few events. So that's what's called by super spreader events. So congregations, anything that brings people together in large numbers, whether it is a soccer match, whether it is naming ceremony, whether it is a funeral, whether it is school, these are indication of super spreader events. And I think that probably what we saw initially in Kano, and not only in Kano, but probably the other reports of Azare in Bauchi State, reports of Yobe State and others, probably those were the suggestions around as a result of super spreader events. Many of them were big people who died, many people went to the funerals, and many people got infected through that process as well. So I think that we have found ourselves whereby I think that initially I think that those super spreader events were the one that really led to the situation where we have now found ourselves. And I think that in the northern part of the country, I think that the reality that even before COVID, if you look at the number of the endemic diseases in the country, for a long time, the rates are much more higher in the northern part of the country, which is a reflection of inequality and access challenges, which are very prominent in the northern part of the country. So when you have that kind of underlying condition yourself, so I'm talking of things like malaria, tuberculosis, child mortality, under 5 mortality, high level of nutrition. So if you look at all those indices, you compare it in the northern part of the country with other part of the country, you find that there is much more higher levels of those problems, which is already an underlying condition. So now you add it out on top of that of COVID, then what happened then is that underlying condition then exacerbates the situation and therefore makes it even much more worse than other parts of the country. As well, yeah.
The MacArthur Foundation just reported on its periodic review. How will this review affect your work in Nigeria?
Well, it will not be a major change. I don't think that there's going to be a major change in terms of the work that we are doing. I think that certainly one of the changes that is happening is that given the situation that we have found of someone with COVID, I think that it's likely that we may spend some. We are trying to see if we can get more resources in terms of the COVID response. So we are trying to see if we're trying to see if we can support the UNDP. There's a joint donors basket that have been set up by UNDP, and we are trying to see how can we support the to get some materials for the country, especially in terms of personal protection equipment that we want it to be available nationwide so that our frontline health workers are protected. As we all know, they have been the victims in many of our hospitals and clinics. Many of them have been infected, and I think that definitely being our own frontline workers, I think we really don't want them to continue to be infected. So I think that is certainly one big change that is going to happen, which is essentially trying to look at opportunities like, I don't want to use the word opportunities, but looking at situation that so appalling and so difficult. And I think the foundation in the spirit of being in good neighbor, so to speak, whereby you don't want to be in a situation whereby you allow other people you are close to them are suffering when you are protected. So I think that is one of the major things that we're trying to do in terms of the change.
MacArthur Foundation has been working with a lot of organizations in Nigeria. In fact, it's on record that apart from the USA, where the fund has support, Nigeria is the second biggest, next only to the United States. What interests over the years that you have been working here? What measure will you say put at it as satisfaction back home in Chicago that look, this fund is achieving its objectives?
I think I would say, in the sense, I would say it's actually the Nigerian people. I think that's what the difference is. I think that our colleagues and us, we all know that there are serious problems with our governance structures. We know we have serious problems with our leadership. But definitely, the spirit of Nigerians and the spirit of Nigeria, the spirit of being the I can do spirit. When you talk to every Nigerian, they would always say that I can manage or I go manage. So that spirit is what really drives our interest and our passion about the country. That despite all the limitations and despite all the challenges our people are facing, our people are always willing to do whatever they can in order to make their own lives better, to improve the quality of their children, You know that, Austin, even, and I'm not saying that in any derogatory way, even people who hardly make a living in this country, you find that they are striving and struggling every morning and every evening. I'm not in any way also glorifying that kind of life, but I'm trying to say that there is a spirit among Nigerians that despite all the challenges, despite all the limitations they have, they will try to, they will make it. And so that spirit is what really, I think, gladdens the foundation and gives us hope that with this collective spirit of we can do, hopefully now we can leave this country in a much better situation for our children and for our grandchildren as well.
Thank you so much, the Africa Director for the MacArthur Foundation, Dr. Kole Shettima. Thank you so much for joining us on the program today. Thank you so much.
Thank you very much as well for having me.
You have heard him. That was the director, Africa Director for the MacArthur Foundation, Kole Shettima. I want to thank Eze Wawangu for being very, very patient with us in the studio, listening to the boss of the MacArthur Foundation in Africa. Eze Wawangu is writing, still here with us. I must tell you that he is the co-convener, Say No campaign, and the executive director, Peer Advocacy and Advancement in Africa. Let me just come to you and ask you, Say No campaign and PACA have been mobilizing against corruption in Nigeria over the years, doing citizens mobilization, tracking corruption, particularly even during this COVID-19. How is your work being affected by COVID-19?
Thank you, Hidia. I think that the pandemic, of course, is restraining in certain respects, but that does not by itself limit the ability of any serious organization to do the task that he has set for itself. We are fortunate in Say No campaign and PACA that from 3 years, nearly 3 years ago, we did set up anti-corruption networks in the FCT and 5 other states in the country. So those anti-corruption networks in those communities are already effective and working and engaging. So
you just lashed on them.
So we took
advantage.
Not just that we took advantage. What we did is that we then mobilized them to say, look, the areas that we're interested in, which is accountability, transparency of both the distribution of the palliatives and the homegrown feeding program, happen in communities.
Yes.
So ordinarily,
after they are feeding the children,
they are feeding the children. So, like I said, it's very misleading. Whatever to call that, a homegrown school feeding program when the schools are not. But whatever it is, food were taken.
It's home feeding program.
Yeah. So food was taken to children at home, and these things are community centric. They are happening in those communities. So we were fortunate that we said, oh, cool. So it's not going to cost you a lot of things. So we did. We organized some training. As much as the protocols, the COVID-19 protocols could allow. We organized some trainings, and then they've been doing excellent work in those communities.
Okay, but are there areas COVID-19 may be preventing CSOs from effectively tracking and mobilizing against corruption?
That's the point. The point is that when we have a restricted definition of what civil society is, the community, everything we do, every idea of social mobilization must be community-led. If it's not community-led, then you are speaking English as far as I'm concerned. Yes, you are so if it's community-led, then you relate with your foot soldiers in the communities. But having said that, there are challenges because no matter what it is, I've found out that sometimes you need to inspire. You need to inspire confidence, and you don't do that virtually. So no matter how much you try, you inspire through engagement, through that's the restraining force.
Because Baka, for instance, I know you were working seriously at the community level with traditional rulers.
Yes.
I saw you traversing this from Enugu to Borno to everywhere.
Yes.
You were having meetings with traditional rulers, trying to draw them to this area that they can be responsible.
Yes.
Of course, those areas now there are limitations. First of all, you cannot even travel because
we can't travel. Then internet penetration.
Yeah.
Then many of the people we're relating with they don't have Android phones. Even when they do, the power is a challenge.
Yes.
And even if power is not a challenge, data is a challenge. So and then the lockdown also affected people
businesses
psychologically.
Yeah.
So but we're upscaling all of that. In spite of that, like Dr. Kole said, I Can Do spirit came up in the COVID period. We saw a lot of people saying, look, whatever that takes to engage, especially issues around accountability and transparency, we're going to get involved in it. So those challenges, you have communication challenges, you have the inability to move around and all of that. But having said that, we're good.
Let me ask you this before I open the phone so that they can interact with you and interact with us. A lot of, unfortunately, corruption came in with the COVID-19. A lot of corruption suspicion came in. People were thinking, governments were not open, we have to be drumming. Look, let there be accountability templates in the way monies are being spent. It took time before ICPC, the Office of the Accountant General, and then the BPP came up with their guidelines, and a whole lot of, we saw a whole lot of the fight being diverted again from the general public, that the template we already know to the COVID-19 self, which actually demanded emergency spending. How did you deal with it? Because you also monitored palliatives distribution in Abuja. So how have you dealt with this?
Well, first and foremost is we don't approach our work from the point of suspicion. We approach from the point of what we need to do. We know, and incidentally, Priborg is also in the forefront of that. We know that emergency situation create fire brigade approach.
Yes.
And once you have a fire brigade approach, then corruption is very rife. What it means is that you are going to you have to virtually sidestep processes. And once you sidestep processes,
it is open for.
It's open for. And then so our work is to zero in at this, and Primorg and all of us paid attention. So it's not we are not coming from the point that something is wrong. We already know that something could be wrong. For instance, if you say you are giving 600,000, you are going to distribute 600,000 bags of rice and condiments within the FCT, procurement processes will have a challenge.
Yes.
Taking count will be an issue. And I've also often told people, if you stack plastic chairs here, for instance,
yes.
If you say 1,000 plastic chairs, if you stack it here, even if it is 790, people will think that the 1,000 is complete.
Yes.
If it is when you take a count, and I've often said, democracy is about questioning. Democracy is predicated on the ability of citizens to ask questions and get answers. And the limit of the questions is you can stretch it. After you have counted, then you now ask the question, who supplied the chairs? After you have asked who supplied the chairs and the answer is provided, you say, what is the quality of the chairs? Mm-hmm. After you have done that, you said, are you related with the person who supplied the chairs? The questions continue. So we're not
about accountability.
Yes, so it is not an adversarial relationship. The relationship is not that of a cat and a mouse trying to find out whether the fish has been. No, it is that we have responsibility as civic leaders to ensure that people who have responsibility, who have been given the trust, do what they should do. And the palliative emergency, the public health emergency that we have has its own political economic questions. Procurement will take a backstage. Procurement procedures, no matter what guideline you put, the thresholds will. So, but what we will do is that after all of this, we still will demand
What happened?
what happened. We cannot, because there's this drama that is going on somewhere. A governor said he was going to build 450 houses, and then eventually he didn't build up to 50. And people say, "Oh, thank you. Even if it is one he built, we are fine." No, but that's not democracy.
Yeah.
Democracy is not even if we have seen one before. Yeah, at least we have seen one. That is a situation in which you allow people to get away with the kind of things that we don't want in this period.
Okay.
So there are huge challenges for accountability and transparency, but it is not from the point. Let's not get it from the point of people have stolen. Let us assume that they have not stolen, but they have responsibility to tell us
What they are doing.
Yeah.
Well, Adaobi, still have one more question for him, but the listener out there, interact with us. You are always free to send us your suggestion. If you want to come by way of text messages, you can send us a message, and Adaobi will give you those information now. But when we open the phone lines, please let's be civil. We have had the Africa Director of MacArthur Foundation. You want to speak to some of the issues that he raised. Ezewawa is right in the studios here. How are the civil society groups managing to cope? Are there questions you have or contributions to make in that area?
And the number to send your messages 0902 265 6167.
And it's Public Conscience on radio, and we're ready to take your calls. Let's see who's talking to us now. Hello. Your name, where you are calling from, please go straight to the point.
Okay, my name is Queen. I'm calling from Papi.
Thank you so much, Queen.
Yes, I wanted to ask the gentleman in the studio that said the train people that were distributing to children in various communities. I want to ask, is this community, are they selected, or is all communities that we have government primary school?
Okay, that is the school feeding program. I don't think my guest is one of those distributing, but we monitored and it's also seized of some of the information. This food distribution process is part of what has been happening. It's not a new thing. It has been happening in school, but the government decided that they would take the food to the homes in some states, not all states. Maybe I would just allow him to respond.
Yeah, the FCT, for instance, the FCT, the distribution happened in FCT. And so we have the network in Buhari, in the 6 local governments, and the report on the homegrown feeding program will be out in another 1 week or thereabout. What we did was that we trained people, and they went to homes. They went homes in those communities, and they were asking questions and getting pictures and getting interviews. All of that is being put together right now. In a few days' time, we'll bring that report out.
Okay, let's take the next call. Hello.
Hello.
Thank you for joining us on Public Conscience. Please, your name, where you are calling from, and please go straight to the point.
My name is Tunde. I'm calling from Lokogoma.
Thank you.
Okay. My observation from the country director of MacArthur now, so is that there is a misconception that has not helped the North to grow. Unfortunately, I had the director also mention it, that when it comes to the issue of health and some instances, health issues in the North, that the North is surcharged or inequality or something of that margin. That was the word he used. But the truth remains that the North has actually not identified its source of its own problem. That if the North, some of the problems we attribute to inequality in the North are actually self-generated, that the leadership and the political class of the North needs to address by the masses, by the people resident in the North, the underlying cultural and religious practices that puts people's health and livelihood at risk should be addressed. And then we will begin to see that there is no bias by any. What has the government really done for any part of the country as far as the health issues are concerned? But people are more educated. People are taking their lives into their own hands, trying to survive on their own. Some culture and practices in the North do not support that. So what I'm trying to say in essence is that misconception needs to be removed even from the elite, that it is an inequality. No. Livelihood, religious practices, cultural practices of if you look at the problems, you will understand that some of these problems are actually caused by practices and not that it was a natural phenomenon or something. If VVF, some of these other problems that happen in the north, we can identify how they come to be. So I think the professor should also open up and try to see how they can affect people's belief and practices for healthy living in the north. These are my opinion, please.
Thank you very much. I think you are on the same page with us and with the African director for MacArthur Foundation. I would say that you are on the same page. He said actually that it was good, in quote now, that this thing started in Lagos, because if it had started in the north, because of the things that are on ground, they would not have been able to cope. What are the reasons? The reasons are the reasons you have given. Some of the things that are endemic with us, and that's what I think the doctor was also alluding to, that those are the things that cause the differences that we have on ground. Let's see if we can take one or two more calls. Hello.
My name is Pius.
Thank you so much, Pius. Go straight, please.
My question is a follow-up to the first question on this program about the home feeding program or school feeding program, whatever you call it. Did the civil liberty organization find out from the organizers why this program has to be selective, irrespective of it's a national program being sponsored from national force, and then some states are getting it, while some states are not getting it? What was their reason? Is there any place where people don't like to eat, or is there any class of people that are meant for it? This is my question. Please let tell us why it shouldn't be simultaneous in the whole of 36 states of this country.
Okay, thank you so much. The Say No campaigns, they have a report, at least the areas they have monitored. Ezewamagbe is right here in the studios, and he will talk to those points. Maybe the reports will contain why is it that they are doing it in Abuja and they are not doing it in my village in those states, all those kind of things. But I don't know if Ezewa was there when they were formulating the policies. But let me just allow Ezewa to quickly respond to the issues that were raised.
Well, the social intervention program had its own challenges. A lot of the governors did not initially key into the program, and the issue of even social register and the politics of who controls the process. They had this daggers drawn situation with Mrs. West. It was public knowledge. So the people who keyed in are the ones who are taking advantage. The governors who didn't want to politicize, who allowed the process to come into their states, are taking advantage. And that is why the president is saying expand
the process,
expand the social register, because of those challenges. Now the challenge is that we pay attention to the national, and the subnational is really where the issues are. Look at the issue of counterpart funding for UBE. Many states have not been able to draw funds from the universal basic education because they didn't bring in their counterpart funding, and they will be, instead of their own citizens to say, why is it difficult for you to put your own counter so that we can benefit from this, they think it's a largesse.
Let's take hello. Thank you so much for joining us. Please tell us your name, where you are calling from, and then go straight to your point, sir.
I am Mr. Edward. I'm calling you from Utako.
Thank you.
Yes, I want to say what a wonderful name, from school feeding program to a home feeding program for our children. I think I want to ask a question. If the home feeding program of the team is still ongoing, or they have stopped feeding our children at home from now.
Okay.
And I think that it could have been a good thing. Since we don't even have a good school for our children to sit down and learn in our enabling environment, it could have been a good thing for them to channel all this one they are using to feed our children at home, to make sure that the school they make the environment to be conducive and build more classrooms for our children to sit down and learn in an enabling environment, not to be channeling the funds, saying that they are feeding our children, in which, in my own perspective, I know that this is a scam.
Okay, thank you so much. I'm happy you said your own perspective is a scam. But we have heard Ezewa Wangu telling us that there's a process that was on ground, there was a template that was on ground, there was a data that was on ground, and that some states were reluctant. And when this sudden thing happened, it was like, what do we use? And the federal government latched on those things that were on ground. Now, the federal government, the president has directed that they should expand and begin to go back to the basic things that ought to have been done so that we have it more taken up. Of course, this program is not about school feeding program, and this is why one is not working for the federal government. It's an NGO person, is the one coordinating affairs to be sure that they monitor and hold the government accountable in their own way at the community level and at the national level. We have had the director, the Africa director for MacArthur Foundation, Dr. Kole Shettima, speaking to the issues of how the MacArthur Foundation is supporting the anti-corruption war in Nigeria, and how the no dying spirits of Nigeria is the passion that is driving the MacArthur Foundation in Nigeria. But we have to wrap up now. Let's take the last from Ezewa Wangu so that we can quickly wrap up. And now, the way forward. We are looking at COVID-19 in the face. It's going, but the figures are rising. It's not going. please come closer to the microphone.
It's not going. This is the big. Let me tell you, and I think we need to underscore that point. This is the time to take extreme personal responsibility.
Yeah.
Yes. So you saw the joke. The joke was on people of the Abia governor.
Yes.
When this came, that they have it from God that no disease will come to them. He's in isolation. There's a challenge. We spiritualized a pandemic, a crisis. We make a joke of it. We are throwing sarcasms all over the place, and then people are getting into. Lagos is in crisis as we speak right now. They don't even have anywhere to put to isolate people anymore. So I really get very whatever at any point in time people start talking about is a scam, is a this and all of that is going. We are dealing with the crisis now. What has happened is that the government said you don't want to stay at home, Abi. Come out, come and confront it.
Go and meet the light.
Go and meet whatever it is. So it is now your time. What are the health infrastructure that we have that can deal with a crisis if we have one? We don't have any.
All right.
We do not have any. So for the homegrown palliative advocacy, accountability, transparency issues, we are on it, and it is not the work of civil society. Civil society
is the work for everybody.
Is the citizens. You are somewhere. If this happened in your community, there is no reason why you shouldn't call public conscience on radio and say, we saw this, it happened, it didn't happen. All of us have responsibility, and that is what has happened with our community people. Right. They are calling us and saying, people are being fed, but they didn't get the required ratio. But what is important is that people are coming in and speaking up, and we want more of that to happen.
Thank you so much.
And Dr. Kole Shettima, as you know, has a cohort. It's not just Primog. All of us, very many of us are involved in the support template that MacArthur Foundation is using to ensure that transparency and accountability is put on the front burner in Nigeria. And we want to thank him very specially for that.
We cannot but just continue to thank the MacArthur Foundation for what they are doing. And that will be now.
Please visit the news page of our website, news.primorg.org. That is news.primorg.org. For all the details of our reports and interviews, visit our website, primorg.org, to get all the information about Primorg. Many thanks to Dr. Kole Shettima, African Director, MacArthur Foundation.
And I want to appreciate Ezewa Wangu, co-convener of Say No Campaign and Executive Director, PRA Advocacy and Advancement in Africa, PACA. Public Conscience on Radio is supported by the John T. and Catherine D. MacArthur Foundation, committed to building a more just, verdant and peaceful world. Please, you can get more information about the MacArthur Foundation if you visit their website, www.macfound.org.
Join us again same time next week for another interesting episode of Public Conscience on Radio. I am Adaobi Obiabumo.
And I'm Okiri Agbonsuremi. Like Eze11 said, please, this is the time to get serious and get more responsible. The COVID-19 era is not over. We may well actually be facing a second wave of it, so be careful and be responsible. Let's do it again next week when we come back on the program.